Leprosy is a disease that affects the skin and the nerves, and for centuries it has been perceived as contagious and incurable. Although diagnosis and treatment are easier today due to improvement in medicine. Welcome to the program that gives you first-hand info on health matters. I am Rekia Mahmoud Awal, and today on the program we'll be looking at conditions affecting life of people living with leprosy, followed by a review of challenges militating against the elimination of leprosy in our society. And still to come is an interview segment with a dermatologist that will throw more light on what leprosy is all about. Please don't go away.
There is no food, there is no medicine in their clinics. And they go out for begging. There are environmentals that they catch them and put them in prison. So they're calling on government to assist them.
Leprosy is one of the oldest diseases that affects man. Unfortunately, when leprosy affects a breadwinner, the consequences affect the entire family. Because of the stigmatization, like these school pupils whose parents have been affected by leprosy, their future seems to be put on hold. However, in the midst of this optimism to read and write, they are ignorant of basic educational needs for better education.
They will come to school without uniforms. They are writing materials. They are reading materials also. Some important things that we ask them to provide for their pupils, they will see like they are disturbing their children. Our aim are to bring them up to become somebody in future.
In order to improve the living standard of these leprosy sufferers, social infrastructures were provided, such as houses, school, and clinic.
Anytime there is a new case here, they come, we check the patient, and then we refer to the supervisor in Kwali. Then the supervisor confirms. After confirmation, then we are giving drugs here, then we start issuing the drugs.
Because of the stigma, because of the devastation and deformity of the person that are affected by leprosy, they need support, they need rehabilitation, they need empowerment. So holistically, this is a package of a hospital which is manned by staff from the FCT, nurses, a doctor, and a set of nurses which span out services from primary healthcare, basic primary healthcare to antenatal and so on, and immunization. So they refer difficult, complicated cases to General Hospital Pali. And they have school, which is also being manned and supported by UF, the FCT. They are at the extreme of life, of poverty and so on, and physically challenged.
If the deformity results to the point where they lose their limbs. For some of them, they are also giving rehabilitation socially, because you will agree with me that in our society today, we still have communities set aside and labeled as colonies. They often need a lot of social and economic support. Again, that is an aspect that we as an organization we support. Basically, we run projects to be able to help address all this.
Despite these supports, leprosy disease in Nigeria has been on the increase.
We have about 29 as of last quarter of the year. I said, there are some countries across the world, including Nigeria inclusive, still having the pockets of the infection ongoing. And why it is still receiving much needed attention, we are yet to eradicate, we are yet to interrupt. There are still evidence showing that the disease is still being transmitted.
Similarly, new cases are discovered each year, thereby making the disease to be a public health problem.
There are a lot of misconception and understanding of the disease itself. Over the time, because of that, people don't present very early, and it has been lingering from time immemorial. It is an chronic infectious disease which is caused by a bacteria called Mycobacterium leprae, which has a special predilection, means affinity to certain parts of the body, particularly the face, the hands, and the feet, which are mostly affected, the nerves around these parts of the body. So it does a lot of devastation because of that late presentation. So people now come out with some deformities on their faces, on their hands, and that is how they looked at as the leprosy itself, which is not. However, leprosy, we still have the cases as evidenced by the chain of transmission. Adults rarely harbor the diseases. So in the program, when we see those vulnerable groups like the children coming down with the disease, which ordinarily they're not supposed to have it because it is not hereditary, it gives a clue that there's chain of transmission going on. So it means they are getting it from the adults. So this is why it is still a source of concern, and with the issue of late presentation.
Leprosy is a disease like every other disease, and the reason it's still a public health problem is because it's still very much around with us. We still find over 2,000 to 3,000 new untreated cases annually. And in the world rating, that puts Nigeria as still a country that has the endemic problem of leprosy. In the last 3 years, we found ourselves recording over 3,000 untreated cases. And what makes this a concern is that we are beginning to find children coming down with leprosy. Some know that it is leprosy, but because they are afraid of what the society will say, they don't want to be isolated, so they hide it.
Eliminating leprosy in Nigeria has become a daunting task. However, to achieve success, stakeholders in the fight against the disease in Nigeria will have to go beyond the surface.
Public need to know that we no longer need to fear leprosy as a disease. That's one. It is curable. Two, we need to increase the level of awareness. We should come together, pool our resources together to increase awareness, put resources to go out and look for places. Because leprosy is a disease that if you don't look for it, you won't find it. So we need to go to the very hard to reach areas of our communities and find them. Once we're able to find them, we'll be able to arrive at the zero transmission that we all desire to see.
With such collaborative efforts, those affected with leprosy will not have to be worried, but optimistic that their future will be taken care of.
Although government in the past has made efforts towards rehabilitating these people, presently it looks as if they have been abandoned to their fate. We can still turn things around by committing more resources for their welfare. The use of drugs has improved the treatment of leprosy, but there are still obstacles in the elimination of leprosy. This feature will tell us more.
In the past, leprosy was regarded as an incurable and contagious disease, thus creating the myth of stigmatization among those affected with the disease.
Look at our community. We have problem of stigmatization. You and I know that leprosy is not something we play around with. People that come down with this disability have been highly stigmatized against. Though granted the fact that in the Bible it is there, in the Quran it is there, it's a long-standing problem that has been associated with stigma. It's still a problem amongst us, even we that are the healthcare workers. Because when this patient come in the hospitals, like, why are you coming here? Everybody tends to stigmatize against them, thinking that with the notion that it is highly infectious. It is not as infectious as it is, bearing in mind that the mode of transmission is airborne.
However, the use of drugs has brought hope to victims of the disease.
The journey for somebody who is found with leprosy starts from when he or she is diagnosed. Once they find that out, that's where the journey starts. When they commence treatment, in fact, less than a month after an individual commences treatment, such individual can no longer pass the bacteria to another person. Now, the treatment lasts between 6 months and 12 months, depending on the bacterial load in the person's body. Those who come in late are the ones that you see that have developed physical deformity. We have a plan for such people. Some of them, we provide artificial limbs for them.
While efforts are being made to tackle leprosy through the use of drugs, on the other hand, poor awareness and other issues still remain an obstacle in the elimination of leprosy.
Leprosy is a problem in the country. We have so many issues and challenges that we face in the control of leprosy. Commonly among them are one, awareness. There is poor awareness among the population, among Nigerians, about what is really leprosy. Because in the country, when we look at it, we still have this belief that, oh, it's a thing of the past. It's long gone and it's no longer existing. But actually, we have many cases among our people there in the community. So awareness among the people is a problem, is one of the key issues. And then it poses a challenge, because when they don't even know that they have the signs and symptoms of this disease, some of them stay in there and they don't present until when it is late. So late presentation is one issue again, because when they come in, they are very bad. Then they would have started having this loss of sensation, loss of the limbs, the lower limbs, upper limbs, and the deformity and all those disabilities that it would have caused. Another one is what? Resources to diagnose them. Many of the healthcare workers in the hospital, even doctors, don't even know how to diagnose leprosy. We find out that most of the time, with any skin problem, we refer to a dermatologist. The dermatologist should be empowered with the diagnostic capacity to diagnose leprosy. We have many hospitals where we treat leprosy, but the awareness is not even there among the public health physician, one, and even the general health workers, especially physicians, that these drugs are available and they are free of charge. The drugs for treatment of leprosy, they are all available and they are free of charge.
One of the huge challenges that people who suffer from leprosy suffer today is stigma and discrimination. And one way to propagate that is through the use of certain terms. For example, when we hear people use the word leper, it's a very derogatory term, and we encourage that people should not use such term to label people who had suffered from a disease. Rather, you can refer to them as persons affected by leprosy. I want to use this opportunity to just call on the general public that leprosy is not a death sentence. Leprosy is not a disease that we need to be afraid of anymore. Leprosy is curable. Drugs are available, and treatment is free.
Since experts are of the opinion that late presentation of the disease remains one of the obstacles, those affected should be encouraged to make early presentation at the hospital so as to avoid damages to their bodies.
The assurance that leprosy can be treated with drugs is a welcome development. So let's take early presentation and get treated. Dr. Adamu is here to educate us on leprosy, causes, symptoms, and other things that we need to know.
What is leprosy?
Leprosy is a disease that has been around for ages. It's actually disfiguring disease that can cause a lot of havoc if not detected early. That's some of the things that we are trying to tackle actually with concerning leprosy. It affects mainly the skin, okay, and also other organs like the eyes, the nose, the nerves, the kidneys, and even the reproductive organs.
What are the causes of leprosy?
The cause is the bacteria. The bacteria itself is slow growing bacteria that's found in the body. And you tend to get it when you come in contact with the secretion of an untreated patient, a patient that has leprosy. It is transmitted by the nasal secretion, that is nasal secretions or droplet secretion from the nose of a patient that has leprosy. It's not actually easy to get in the sense that about 95% of people in the population have resistance to getting leprosy. But you get leprosy when you have contact with the nasal secretion of a person that's infected or prolonged contact, most likely prolonged contact from such a person. Okay. It takes a long time after contact. So the period between when you get leprosy and when this thing starts to manifest can vary between 2 to 10 years. That's why sometimes it's difficult when a patient has leprosy to know when the patient actually contacted it. That's what we call a long incubation period when it begins to manifest. And how it manifests, depending on the severity, is different. It could just come as a rash.
How can someone contact leprosy?
The commonest way leprosy is contacted is from family members. That is close contact, close, prolonged contact. Like I said, leprosy is not easy to get because it's not, but the people that are most likely to get it are those people that have family contact, especially children. Children of patients that are infected with leprosy and that are untreated. So it's not advisable. But if the patient is treated, the patient no longer becomes infected. So if you have leprosy and you have been treated for it, you can stay, family members can come in close contact with them. But children of people that are untreated with untreated leprosy have a high predisposition to get leprosy, to getting leprosy. But casual contact, everyday contact, like touching and everyday social contact in the environment with leprosy patient would not likely give you leprosy.
What are the symptoms of leprosy?
Depending on the severity of leprosy, leprosy will initially present as just a rash. A rash on the skin that is light colored. Okay, the skin that is light colored, it will just come as a pale light colored skin that usually has lost sensation. There's lots of sensation in that place. Sometimes it comes with bumps and nodules in the face that just refuse to go away for many years. These are some of the early signs and symptoms. Sometimes people fail to recognize it early. They can go on, this can go on for years. Then severe forms of leprosy begin to set in if not recognized early. And then it can lead to things like blindness. It can destroy the bridge of the nose, lead to nasal collapse, and disfigure the face. But in men, it can even lead to infertility. And most importantly, it also leads to loss of sensation in the nerves. When this loss of sensation in the nerves, but it can also lead to destruction of the nerves. And with destruction of the nerves comes loss of function of the nerves, and therefore loss of function of the muscles and parts of the body that are nerves operate. So it comes with great disability, weakness, and paralysis of the affected part of the body that is supplied by the affected nerve. And it leads to great disability, which is one of the most important complications of it. But by the time a patient reaches that level, it means that it has been there unrecognized and untreated for a long time. So the important thing about it is to recognize it early. When you have a suspicious skin lesion, you see a dermatologist early, have it evaluated, especially a light colored skin patch that you do not feel, that you do not touch, that does not feel pain, that you do not have the pain or temperature sensation. Because with that loss of pain and temperature, or loss of pain and touch, you can easily get injured. You can get burns there, you can get cut there without realizing it. So people will tend to have a lot of deformities and disabilities from injuries they sustain from those parts.
How do you diagnose leprosy?
To diagnose the form of leprosy, you identify when see a dermatologist or a doctor early, and he will carry out that test to diagnose it.
What is the treatment of leprosy?
Leprosy has been curable since about 1940. You know, in the past, you hear stories of of people being stigmatized, of that it's incurable or is hereditary. All that is not true. It has treatment, as the treatment has been available for since about the 1940s. You take about 3 drugs for 6 months or 12 months, depending on the severity, whether you are dealing with the mild form or the severe form. And these drugs are available freely in the various leprosy programs that are available within the country. They are free, they are available. So the important thing is to diagnose it early and refer the patient for early treatment.
Is there a high awareness on leprosy?
Well, in Nigeria, if I'm correct, we've been able to cut down on the number of leprosy cases since about 2005. Okay, it's been going down, but I think we tend to have started relaxing a bit, and the number of leprosy cases have started rising up again. And you don't see people, although you don't see people with resolved fingers walking the street like in the 80s, but the awareness is still not as good as we want it to be, in the sense that people don't seek early treatment. They try all sorts of medications first. When they have skin rashes or they notice something wrong with their body, they go around trying all sorts of medications. They go to traditional healers, they do home medications and all that, such that by the time they present, it's a little bit late, or it may not even be recognized early. So we need to carry on awareness. We need to improve the awareness about how it presents and how you can get it diagnosed properly and receive treatment. We have succeeded in reducing the burden of leprosy in the country. Like if I need to understand that in Abuja, like in 2014, we had about 2,800 cases in Nigeria. In Abuja, we've recorded about 15 or 18 last year. So even though it's on the downward trend, but there seems to be resurgence, we need to continue to double our efforts and not to relax, and improve awareness. Because whenever a disease, we are achieving victory over a disease, if we do not continue to improve awareness and enlighten the public about it, we tend to realize it may become resurgent, because we have not completely eradicated it in the world. I mean, even in Nigeria. But we need to continue to create awareness about it.
How can leprosy be prevented?
The first thing is people that have leprosy, we have to be aware about the symptoms of leprosy and come in early for treatment. Because it's treatable. Once patients are treated, they're no longer able to spread it to members of the environment. And the commonest members of the society, and the commonest people in the society that are susceptible to it are children. Children of adults that have this disease, because they are the ones in closest contact with them. The burden on children is high. Between the ages of 5, around the ages of 5, children are susceptible to it, because they are the ones in contact with their parents. If a parent has it, the closest person to the parent is the child, and those are the ones that tend to get the disease, and then they spread it. So people should seek proper medical care, get it diagnosed early and receive treatment. Then they become safe. Safe in the sense that they are no longer able to transmit it to even their closest family members or other members in society. That's the best way to prevent it, is to treat the reservoirs that are within the environment, because human beings are the reservoirs of it. There are other animals, but the commonest mode of transmission is human to human in our environment. Unlike some other diseases where it is from animals, but the commonest mode of transmission is human to human. So the humans that have it, we need to get them all, diagnose them, treat them. That way they are not able to spread it to other members, especially their family members. Naturally, 95% of the population have natural immunity. It's not an easy disease to contact. 95% of people in the population have some form of natural immunity to it. It's only the remaining 5% that have susceptibility to it. Those ones can safeguard themselves to the disease by simply preventing themselves from getting contact with the nasal secretions, the nasal fluids, the fluid that's coming out of the nose of people that are known to have those leprosy patients, that don't have that leprosy disease. Avoid contact with it until the patient is treated, because that is the mode of transmission of it.
This is how far we can go on today's edition of Your Health. Remember, leprosy has no myth, no more stigmatization, and you're sure that it can be treated with drugs so long as early presentation is made. So we come your way same time, same station. Remember that your health is in your hands. Take charge of it and see you next week.